This presentation is oriented towards the medical students in my pathology courses. We will discuss some learning strategies based on Terry Doyle's book on learner-centered teaching to help you learn and remember new information long-term. By the end of our discussion, you will be able to explain what learner-centered teaching is, how it helps students learn better than traditional lectures. You will also develop strategies for using learner-centered teaching methods to improve your long-term learning. So how do we learn? According to Doyle, learning requires actively focusing on the information presented, analysis in the frontal cortex, and formation of new neuronal networks in the hippocampus where the new information is connected to previously established neuronal synapses. For the information to be transferred to long-term memory, it must be repeatedly used and practiced. So what does this mean for you as a student? To learn and remember new information over time, you must first focus your complete attention on the material presented, only study small amounts of information at one time, which can be easily processed, connect the new information to what you already know, and repeatedly practice using the new information. Doyle believes that for optimal long-term memory formation, learners must process and analyze presented material, assimilate it with what they already know, and practice using it in a relevant real-world setting. In a traditional lecture, most of these learning steps are carried out by the faculty members presenting the lecture, and your role as a student is to passively absorb the information, which is not the best way for you to remember the information long term. The goal of learner-centered teaching, according to Doyle, is to ensure optimal long-term retention by having students do most of the work of learning while faculty facilitate and support their learning process. This means that the more independent reading, analysis, and synthesis you perform, the greater the likelihood that you will remember this information over time. Listening to your instructors present their summary of a textbook topic is not as effective for your learning as doing the reading and summarizing yourself. We will now look at some ways in which you can implement principles from learner-centered teaching to enhance your long-term knowledge retention and recall. How does your mindset affect your learning? Doyle mentions that students establish their learning mindset early in life based on their initial learning experiences. Learners with a fixed mindset believe that their past performance is a reflection of their overall intelligence and predicts their future performance. Therefore, they tend to equate poor test performance with stupidity rather than poor study habits. On the other hand, learners with a growth mindset believe that their performance can be improved by increasing their knowledge and skills. Therefore, they tend to view poor test performance as an opportunity to learn more. Learning is much easier when you have a growth mindset. To figure out your mindset, try to recognize your internal dialogue. Do you often hear yourself saying, "I can never do this"? If so, try telling yourself, "I may have failed in the past, but if I work hard, I will succeed this time." The more you practice viewing your test performance as simply a reflection of your current level of knowledge and test-taking abilities, the easier it will be for you to modify your study habits so you can perform better in the future. I know that you are all capable of mastering the material in your courses, and I will do my best to help you succeed in this endeavor. How well you do is based solely on how much work you choose to put into your learning. Paying attention is the first step to inputting new information into the brain and therefore an important starting point for learning. When students attempt to multitask, for example, check email while listening to a presentation, Doyle believes that their learning suffers because the brain can only process limited information from either task at one time. To ensure optimal learning during any learning activity, you must put away your phones and iPads and really follow along by selectively taking your own notes, summarizing information in your own words, or creating your own chapter summaries or concept maps. Students who actively listen, think about the material presented, and try to integrate it with what they already know are much more likely to remember the material long term than those who try to learn it while multitasking. How does sleep affect learning? Doyle mentions research studies showing that the brain needs time to rest in order to process newly encountered information and integrate it with what is already known. Getting at least 7 to 8 hours of sleep every night allows the brain to recharge and build the neuronal networks necessary for long-term knowledge retention. So, while it may seem counterintuitive, pulling an all-nighter before an exam actually hinders your performance the next day. Not giving your brain enough rest between learning sessions will prevent it from solidifying synaptic connections and will make it harder for you to recall information on the test. For optimal learning, make sure you get at least 7 to 8 hours of sleep every night and take some rest breaks when learning complex material. Doyle cites studies showing that aerobic exercise decreases anxiety and improves mood by increasing production of neurotransmitters like dopamine, serotonin, and norepinephrine. According to Doyle, exercise also stimulates the production of brain-derived neurotrophic factor, which stimulates formation of new neurons and synaptic connections, thereby enhancing memory formation. This means that incorporating at least 30 minutes of aerobic exercise in your daily routine will not only have significant cardiovascular benefits, but will also help you learn and remember information better. As we previously discussed with exercise, Doyle also states that movement helps the brain to function more efficiently and retain information longer. We will be incorporating more movement in our classes by having you walk up and point out findings on the screen when we talk about a new case, and having gallery walks where each team posts their favorite diagnosis around the room, followed by a walking evaluation of the other team's solutions. Along with incorporating aerobic exercise in your daily routine, taking a stretch break when you're studying or walking around for a few minutes may help you focus and remember what you learn better. In my classes, you are welcome to stand up and stretch anytime as long as you don't disrupt your colleagues. Doyle states that both acute and long-term stress have detrimental effects on learning by inhibiting communication between neurons in the hippocampus and frontal cortex. Specifically, acute stress stimulates corticotropin-releasing hormones, leading to destruction of neuronal dendrites and synapses. According to Doyle, studies have shown that meditation decreases the detrimental effects of stress, stimulates portions of the brain that deal with attention and sensory perception, and improves brain function. Meditation not only decreases stress and anxiety, but it also induces structural changes in the brain that enhance your ability to pay attention and process new information, thereby resulting in better long-term knowledge retention. This means that setting aside a few minutes to meditate every day will not only improve your mental well-being, but will also help you learn better. On the day of your boards, if you feel yourself tensing up when you encounter a difficult question, take a deep breath, relax your muscles, pick an answer option, and move on. Stressing out will waste valuable test time and decrease your chances of remembering information on subsequent questions. Per Doyle, research has shown that short periods of intensive studying does not help with long-term memory formation or recall. The best way to remember what you learn over time is to spend a little time every day covering the material, thinking about how it applies to what you already know, and taking multiple practice tests. None of this is possible when you try to cram a large amount of information into your brain the night before a big exam. As you study for your boards, remember that overloading your brain by cramming at the last minute will lead to mental fatigue and poor performance the next day. The more time you spend during your courses thinking about the material you learn and solving board-style questions, the easier it will be for you to remember that information at the end of the year for your boards. I recommend that you stop learning new information a week before your boards, and definitely take the day before your test off to relax, get some exercise, and get a good night's sleep. You may have had negative experiences when working in groups in the past. However, it is important to remember that as physicians, you will be expected to work together in a team with fellow students, residents, consultants, patients, nurses, and ancillary staff for the rest of your lives. The sooner you learn how to communicate your point effectively to another person and disagree in a respectful manner, the easier it will be for your future practice in medicine. During our classes, many of the activities you will participate in involve working together in teams of 5 to 6 students in a team-based learning setting. You will each be accountable for your pre-reading assignments, and your preparation will be assessed both individually and as a group with readiness assurance tests at the beginning of each session. The majority of class time will be spent in intra and intergroup discussions to solve complex medical problems. Although working in a group and dealing with different personalities may be difficult in the beginning, you will find over time that not only are you learning from your colleagues' differing viewpoints, but you are also building communication skills that will be necessary in your future medical career. New neural networks and connections to established networks happen when your brain analyzes the new information and finds connections with what you already know. The more you practice new information, the stronger these neuronal connections become. On the other hand, Doyle mentions that if you don't practice the information, over time the neuronal networks decay and you will forget what you learned. This means that simply memorizing the material will not be enough to remember it long term. To truly retain what you have learned a few years down the line, when you get ready to practice medicine or take your boards, you must practice applying it in the classroom now. Some ways to do this include taking practice quizzes from review textbooks, working on a board review question bank, and solving case-based problems in peer instruction or TBL sessions. How can you remember more of what you learn? Memory recall requires the brain to access the neural pathway where information was stored. According to Doyle, the more synaptic connections you create and utilize, the stronger these pathways become, and the easier it is to recall information. For example, if you used a mnemonic device to memorize a fact that you didn't really understand, and then forgot the mnemonic during your test, your brain has no way to access that lost information. On the other hand, if you took the time to think about the information and figured out how it relates to what you already know, you have now established many stronger neural connections, allowing you to recall the same information faster. It is much easier to remember information when you understand it and have integrated it with what you already know. Try to find the main pattern in what you're learning so you can see how it connects with what you already know. Creating concept maps and chapter outlines can be very helpful in identifying these broad patterns. Concept maps help you organize material so you can see the overall connections between concepts. This makes it easier for you to connect new information to what you already know, which according to Doyle is the key to strengthening new and established neuronal networks. Another way to ensure that you understand what you have read is to rephrase the material in your own words. If you can do this, you know you really grasp the concept presented. The next time you read a textbook chapter, take your own concise notes, try creating a concept map organizing the key concepts presented, and after every paragraph, rephrase what you have read into your own words. This will help ensure that you really understand the material you are reading. You can learn more about creating concept maps to organize the information you learn in the article by Torre and colleagues. Why should you use pictures and multimedia resources when you learn? Doyle cites research studies which have shown that learners remember information best when it is presented in more than one sensory format at the same time. For example, hearing an instructor talk about pathophysiology and seeing histopathologic images at the same time will help you remember better than using either method alone. While I include images in my presentations corresponding with the topic we are discussing, you should continue to supplement your textbook written descriptions with images and diagrams. For example, the University of Utah's WebPath site offers excellent pathology tutorials with images and exams you can use when learning pathology. Doyle mentions that consuming caffeine and sugar simultaneously improves attention and cognitive functioning. These effects were not seen when either substance was consumed individually. Try drinking a cup of coffee with sugar when you are trying to learn something new and see if this helps you focus your attention and remember things better. If you cannot tolerate caffeine, remember that exercise has similar beneficial effects on learning and memory. According to Doyle, studies have shown that varying your study routine can lead to more effective learning. This variation can result in improved ability to focus attention, resulting in more efficient neural processing and knowledge retention. So, if you're used to studying in the same place or same time every day, switching locations and times occasionally can improve your focus and attention, which will lead to better memory formation and recall. For example, if you always study at the library in the evening, studying for a few minutes in the morning in a classroom or trying a different seat in the library may help you focus better. A final strategy to improve your development as a physician is to learn how to give and receive effective feedback. In our classes, you will practice giving and receiving peer feedback halfway through and at the end of our course as part of your TBL groups. Doyle states that it is important to give effective, concise, timely, and constructive feedback to your peers to help them develop their team working skills. At the same time, you should be willing to accept feedback from your faculty and peers as a way to improve your professionalism, collaboration, and communication skills. Remember that any feedback you receive from me is meant to help you improve your performance and develop skills you will need in your future medical career. You are always welcome to talk to me during or after class, or call, email, or stop by my office with any academic or non-academic concerns. My goal is to help you succeed, not only in this class, but also in your future career. In summary, we have discussed how learner-centered teaching leads to better student learning than traditional lecture-based approaches, why it is important for you to do most of the work on learning in order to retain the information you have learned, and 15 strategies you can use to remember what you have learned long-term. I hope this is helpful. Thank you.